Hi, today we're going to talk about documentation. Now, documentation is key in getting paid. Over and over again I have doctors say, well, what makes good documentation? Well, here's the way to tell if your documentation is good. If any doctor of your specialty can walk in, pick up your notes on any of your patients and know what you have done up to this point, why you've done it, what you're trying to accomplish, and what to do next, then you've got good documentation. If they can't do that, you don't. It's that simple. Good documentation should answer 4 questions. What are you doing? Why are you doing what you're doing? What results do you expect from doing what you're doing? And how do you know when you've accomplished that result? The better your documentation, the better the chances of being paid by a third-party payer. The key thing here is you must prove medical necessity. Now, as a rule, if an item or service will result in functional improvement of the patient, it will be medically necessary. So how do you demonstrate functional improvement? Well, that's simple. You use outcome assessment questionnaires. The rule on the outcome assessment questionnaires is this: if you have a 30% improvement from one to the next, then you've demonstrated functional improvement. Conversely, if you don't have a 30% improvement between 2 consecutive outcome assessment questionnaires, then you have a very strong indication that the patient has reached MMI, or maximum medical improvement. Now, in addition, each patient needs to have a written treatment plan. This tells the patient what to expect, but you, doctor, you also need this treatment plan because you need a roadmap to that patient's care. You need to know what your goals are, and the treatment plan should be updated at each re-exam. The treatment plan should contain 3 things: the recommended level of care, the duration and frequency of the visits. That's simple. Specific treatment goals and objective measures to evaluate the treatment effectiveness. In other words, how long and how often are you going to see the patient? What are you trying to accomplish, and how do you know when you've accomplished it? Those are reasonable questions to ask. Now, the treatment plan should include information on the support or brace. Why is the support or brace being used? How the support or brace will benefit the patient, and how this support or brace is going to be used. In other words, is it a permanent thing? Is the patient going to have it from now on? Is it temporary, just to provide a healing environment? Or will it be used in step-down mode, starting at a high-level brace and then slowly working down as the patient improves? Also, how long is that brace going to be on the patient? Now, documentation has to be consistent. In other words, you start with the area of the chief complaint, which must be consistent with the area of the examination, which must be consistent with the area of the adjustment, which must be consistent with the area that you bill. So it all has to fit together. Now, how does this relate to support and braces? Okay, well, you must prove the medical necessity of the support or brace. In other words, you must show that the patient will functionally improve when that support or brace is being used. That proves the medical necessity, or that brace or support is necessary to aid the patient in their activities of daily living. The way I recommend you do this is use the outcome assessment questionnaires. Administer one just before fitting the brace, and administer one weekly for the next 2 to 4 weeks. Now, the primary purpose of the brace or support is to create an environment to aid in the patient's recovery. You should document how this will be accomplished. Demonstrate functional improvement with the outcome assessment questionnaires. It's that simple. Now, one thing you want to keep in mind too is that you need to keep the use of these supports and braces within established protocol. All right? There are ways that they should be used. There are ways that they should not be used. It should be used in the area of the chief complaint or the secondary complaint. In other words, if a patient comes in with nothing more than a neck pain, you have no legitimate reason for that patient to be fitted for a low back brace. Now, some conditions also require an additional exam or imaging to determine the necessity of the device. So you want to include the reason for these additional services with the patient documentation. Remember, if you didn't write it down, it didn't happen. So you need to document that you fit the brace of support to the patient, and that includes writing down the measurements that you took. But you also need to document that you educated that patient. How do they doff and don? And that's bracing terms for take off and put on the brace of support, and under what circumstances should they call you. So remember, in summary here, good documentation is the most important element to getting paid by a third-party payer. Your documentation should prove medical necessity. You do what is medically necessary for the patient, you bill what you did. Thanks for watching. Have a nice day.